Hello everyone, welcome to the series of pathology lectures. Today's topic is vasculitis. This disease is associated with vessels of our body. So let us see what variations do we have and how is this particular disease affecting or producing symptoms in our body. The introduction to this particular disease states that it is a heterogeneous group of systemic inflammatory disorder with structural injury to blood vessels and vessel walls and ischemia. So, uh, let us see into the interpretation of this definition. It's a heterogeneous group means we do not have a uniformity of a single deformity. What we have here is a variety of diseases. Like we can have variations in their manifestation. Also, it is a systemic inflammatory disorder. So we can find it in various parts of the body, and it's associated with inflammation. And it does also causes injury to the blood vessel wall. The major ischemic manifestation are defined by the type and size of involved blood vessel and tissue and organ damage caused by vascular occlusion. So the ischemia and the effect of ischemia, that is lack of oxygen to the provided vessel, and the vessel which would be the organ to which this vessel will provide nutrition. So the manifestation of ischemia will depend on the size of the vessel, and obviously the size of the vessel will determine to which part of the body it is supplying. So we'll have a classification of vasculitis based on the size of the vessel also, so that we can differentiate it into what different types of vasculitis we have. So the possible pathogenic mechanism is how does this vasculitis develop? Is an immune complex formation. One method is this. Second is anti-endothelial cell antibodies might be formed. Third, anti-neutrophil cytoplasmic antibodies may be formed. T-cell dependent inflammation may also present. An infection of endothelial cell, infection of endothelial cell of the vessels may also be the reason. So in majority of them, we can see the first four are dependent on our immune system and how they produce antibodies or they react against the antibodies. So these are the possible pathogenic mechanism that we can have for development of vasculitis. Now, the most important part, that is vasculitis, has is a classification of vasculitis. So vasculitis can be of two types, primary and secondary. It is primary, the vessel size is the key discriminant uh, in the definition of primary systemic vasculitis. That is, primary means the primary cause of uh, vasculitis is directly associated with the vessels. So it is termed as primary vasculitis. In secondary, what we'll have is we can have certain disorders which are related to the connective tissues. We can have infection, we can have some reaction to drugs, and also malignancy can be the cause. So the primary seat of the disease was not into the vessels, but due to the presence of certain connective tissue disorders, or it can be any genetic disorder like Marfan syndrome. It can be an infection uh, somewhere else, and in response to that reaction infection, we can have, if we are consuming drugs to a certain disease, and a reaction to those drugs might also cause vasculitis. So initial assessment, how do we do the initial assessment, or how do we come to know that the person is suffering from vasculitis? So we do look for the clinical features. We also look into the laboratory diagnosis. We also go for biopsies and imaging techniques. And after we have established these factors, we come to the conclusion that vasculitis may be developed. And this somewhere holds true to all the diseases that we know. How we define disease or how we establish that a particular diagnosis is confirmed. As we look into the clinical features, we look up into the signs and symptoms, we go for various laboratory testings, imaging, biopsies, and then we come to the establishment of diagnosis. So, what are the clinical signs that should raise suspicion about a primary systemic vasculitis? So, the first is fever of unknown origin. And how do we suspect that the fever is not coming from any other sources? So we exclude infections and neoplasm. We say that we don't have a known reason for this fever. And then second is unexplained migratory polyarthritis. So what we have is polyarthritis. That is, multiple joints would be involved, and the pain would be migratory. That the patient will say sometimes is having a particular joint, then it shifts to the other joint, then shifting to the other. Then we have mononeuritis multiplex, such as a neurological disorder. A rapidly progressive glomerulonephritis may be seen, palpable purpura, diffuse alveolar hemorrhage. So we do have symptoms associated to kidney, skin, and here to the lungs, that is diffuse alveolar hemorrhage. Unexplained infraction in multiple vascular territories, unexplained multi-system diseases may also be seen. So these are some clinical symptoms, the signs that might suggest to you that the person is suffering from vasculitis. So, and what differential diagnosis do we have? That is, how do we rule out the mimickers? What are the mimickers? Mimickers are the which produces the diseases which produces similar symptom to that of that you are studying, and but they are different. So what symptoms do we have? That is, what are the diseases? That is antiphospholipid syndrome, infective endocarditis associated with embolism, and atrial myxoma with emboli might be associated with this. They have symptoms similar to vasculitis. Others as cholesterol embolization and chronic ergotism might also produce symptoms similar to vasculitis. This is a differential. Then the laboratory workup. Laboratory workup, what we can have is ESR, erythrocyte sedimentation rate, CRP, that is C-reactive protein, CBC, transaminase and liver function test may be done, kidney function test, urine analysis, and blood and sputum culture may also be studied for this. So antibodies directed against neutrophil granule constituent, that is CNCA, stained cytoplasm, hence C. Main target antigen is protease 3, highly specific for beginner vasculitis, that is a type of vasculitis that we'll see. Then PANCA, that is stains perinuclear, and main target antigen is myeloperoxidase, and it's very much associated with Churg-Strauss vasculitis. Then we'll have the imaging technique. So we can go for power Doppler and duplex imaging, MRI, MRP, CT and CT angiography. PET scan can also be done. These are associated with looking into the vessels and their distribution. Techniques will help you at whether inflammatory condition is present in the vessel or not. Then we go for biopsy. So histopathological evidence of vasculitis is the gold standard for diagnosis. Although other techniques of assessing the clinical symptoms, also going for laboratory tests which are non-specific. We have seen LFT, KFT, CBC, ESR. These all are non-specific, but the only gold standard or the definite is the tissue biopsy. Um, from where can we get this tissue biopsy? That is temporal artery, skin, muscle, nerve, gut, kidney. Renal biopsy in patient with active renal disease may show specific diagnostic lesions. This is important. The diagnostic lesion with renal biopsy. This person suffering from vasculitis and it's affected with some other renal disease like glomerulonephritis. So we can see active lesions of vasculitis in such biopsy. Now, as I said, the primary vasculitis can be divided in various types depending on the size of the vessel. So, the classification here is based not only on the primary and secondary, but the second type of classification is based on the large vessel vasculitis, medium vessel vasculitis, and small vessel vasculitis. So, we have this classification. Please have a closer look to it. And we have various names associated with this. Large vessel vasculitis. That is, it has two types: Takayasu arteritis, and giant cell arteritis. Medium vessel vasculitis, polyarteritis nodosa, is also PAN, Kawasaki disease, and whereas small vessel vasculitis, that is anti-neutrophil cytoplasmic antibody associated vasculitis, microscopic polyangiitis, granulomatosis, and polyangiitis, which is vaginous disease, eosinophilic granulomatosis and polyangiitis, that is Chuck-Ross disease, antiglobular glomerular basement membrane disease, and we also have cryoglobulinemia vasculitis, IgA vasculitis, which is Henoch vasculitis. So these are certain types of divisions of the three divisions: large, medium, and small vessel vasculitis. Variable vessel vasculitis, we have Bennett's disease, Cogan syndrome, single organ vasculitis. So it could be only affecting a single organ or the vessel supplying to that organ. And we have types like cutaneous leukocytoclastic angiitis, cutaneous arteritis, primary central nervous system vasculitis, isolatus aortitis. Vasculitis associated with systemic disease, like we will have certain other disease, and this would be secondary to it. So it would be the secondary type. Lupus vasculitis, lupus erythematosus is the disease, and vasculitis associated with that. Rheumatoid vasculitis, after rheumatoid arthritis, if we find symptoms. Sarcoid vasculitis, vasculitis associated with probable etiology, like we can have infection of hepatitis C, B, syphilis, and also drug-associated immune complex, associated anti-neutrophilic complex antigen associated, and cancer-associated vasculitis. This malignant associated vasculitis may also be seen. So these stands out to be secondary to a primary cause. So this diagram is actually showing you that although we have classified vasculitis in three types, that is large, medium, and small, but many a times there will be overlapping that may be seen. So if you start from the left hand side, you can see large vessel vasculitis is demonstrated. Then it gets continuous with the medium vessel and small vessel vasculitis also. So it's not necessary that individually you will find large vessel in a different individual, medium in different, but we have classified them according to the size. But many a times we might find overlapping, that is continuation from the larger to the smaller vessel. So we might find the overlapping also of the three types. We'll continue with the diagnostic part of vasculitis later.